Well, it's a real pleasure to be here. It's my first time in Australia. It's a wonderful opportunity to hear about the TSA in Australia and to meet clinicians and families. A lot of similarities to the scene in the UK, which I'm obviously more familiar about, but also some interesting differences. I'm going to share this part of the presentation with Charlotte Tice. I'm going to give a bit of a sort of background and introduction to some of the tuberous sclerosis research that I've been involved with in the UK, focusing on a project that we call the TS2000 study, and then Charlotte is going to explain some of the more recent findings that have come from that study. So as we, I should say, of course, it's the first time I've ever been to a meeting, and I specialise in neuropsychiatry, child neuropsychiatry. To be described as a luxury is the first time that I've ever had that accolade, so I'm very pleased. As we know, how's this work? Yeah, can you, is this, yes, okay. Yeah, so tuberous sclerosis leads to a lot of behavioural difficulties, and Lisa's sort of outlined some of those. And the extent to which families and individuals get any help or support influences the extent of the impact of the condition on the individual and their family and others around them, and the stress and burden associated with the disorder. And I imagine that this is true in Australia, but in the UK, this graph down the left-hand side of the slide here summarises really the number of families who are receiving help from different sorts of services, and the dark hatched bits of the bar graphs are those that are receiving help, and the greyer, lighter coloured bits are those that aren't receiving help. And on the far right-hand side, because you probably can't read this, of this graph, is the number of families who are receiving, this is in the UK, on part of this project, help from child and adolescent mental health services. So it's a relatively small proportion of families who are linked into child and adolescent mental health services. But as we've been hearing, 90% or so of individuals with tuberous sclerosis have some form of psychiatric or developmental condition. So there's a gap in terms of the extent to which needs are being met. I imagine that's an experience that many families have. When I started on investigating tuberous sclerosis, it was actually one of the pioneers and the founders of the UK Tuberous Sclerosis Association, Anne Hunt, who has sadly died not so long ago, who undertook some surveys in the UK tuberous sclerosis families, which highlighted the fact that the behavioural problems of the children with tuberous sclerosis was one of the most pressing problems for parents and families, that they found that one of the greatest worries for them. Obviously a high level of need in terms of how to address these difficulties. And two of the sorts of problems that are common in tuberous sclerosis, and one of the reasons why I started to become involved in setting up clinics for children with tuberous sclerosis and doing research in the area, was because autism spectrum disorders and attention deficit hyperactivity disorder, which you've heard mentioned, are quite common in tuberous sclerosis. For example, autism spectrum disorder probably affects around about 50% or so of children. Intellectual disabilities also around about 50%. So common, but it doesn't affect every child. And it was partly that question as to why should these problems be so common yet not affect everybody with tuberous sclerosis? What's the explanation for that I got involved in the research? And at the time, this is sort of back in the 90s now, we knew that the type of mutation, whether it was a TSC1 gene or a TSC2 gene mutation, and the extent of the abnormalities in the brain, the cortical tubers and things like that, as well as the severity and type of epilepsy that the children suffered from, seemed to be related to the risk for developing different types of mental health and neuropsychiatric disorder. But at that stage, really our knowledge and understanding of how those risk factors, type of mutation, brain abnormalities, epilepsy, etc., operate to create the risk for neuropsychiatric disorders wasn't really understood. And part of the problem was that information about, for example, early seizures were often we had to rely on parents recalling information about what was going on in their young children's lives during infancy when the children were, 5 or 6 or 7 or 8 years of age. So very tall order to ask somebody to remember great details about the nature of the epilepsy at that early stage. If you ask me, what was I doing last year, or maybe even last week, I might struggle to tell you some of the details about it. But to do it over many years for a complex phenomena like epilepsy is really asking too much, I think. So we knew that we had to try to get better quality information about and record it about features of tuberous sclerosis like that right from day one, really. And we also realized that one of the limitations of the work done at that time was that it was all largely based on children and families who were attending particular clinics in the UK, and that meant that it perhaps wasn't really giving us a truly accurate picture as to what it was like for all families. So we had to think about ways of trying to get a more representative picture. So John Yates, who's a medical geneticist in Cambridge, who's now emeritus professor of medical genetics at Cambridge, and I set up what we call the TS2000 project, which we call it as a prospective longitudinal study. What that means is that we aimed to pick up all newly diagnosed children with tuberous sclerosis in the UK as soon as they were diagnosed and follow them and see how they progressed developmentally, assessing them at regular intervals in order to chart their progress, but also to have good quality information about what things were like during the first year, the second year of life, etc. And the project was supported by the UK Tuberous Sclerosis Association. That provided some of the fundamental funding for doing the study, but it led on to us being able to get funding from other organisations to continue the work of the project. So an American charity called Autism Speaks has funded it substantially. A UK charity called the Bailey Thomas Charitable Fund has, and more recently a charity in the UK called Action Medical Research. So the seed funding from the UK Tuberous Sclerosis Association really led on to more substantial funding over the subsequent periods. And the project has been supported by a sort of network of tuberous sclerosis clinics in the UK and a coordinating committee of specialists from different disciplines, so medical genetics, pediatric neurology, child psychiatry, psychology, all the sorts of disciplines that are required in order to try to understand more about the way in which children with tuberous sclerosis develop and the sorts of problems that occur and when they arise. So the sort of initial findings from what we call phase 1 of the study are sort of summarised briefly here. So as I was saying, this is all children in the UK receiving a diagnosis of tuberous sclerosis between the years 2001 and 2006. So we ended up with 125 children identified during that time. I say children, but actually some of them were a bit getting, you know, somewhat older, so up to 17 years of age. But most of them were presenting during early childhood or infancy, often when they presented for the first time with epilepsy or seizures and were diagnosed at that point. So 91% of the sample had a seizure disorder, but within the sample or the group, there were also about a quarter who were identified very early on, either because of prenatal ultrasound detection of the cardiac rhabdomyomas, the heart abnormalities that sometimes arise, or early on in the neonatal period because of other sorts of complications, polycystic kidney disease or things like that. So there were a substantial minority who were picked up very early on before the onset of epilepsy. And then the proportion of individuals with the different types of mutation, the TSC1 and TSC2 and TSC1 mutations are summarized here. Those that where they were tested but we couldn't find what the nature of the mutation was, and then another small proportion but significant number who didn't receive testing. Again, I understand it from talking with colleagues here that that's also sometimes an issue for families in Australia. So the study, just to summarize what has been done, we've divided it up into really three phases. Phase 1 was the initial recruitment and genetic testing, physical examination of the children, looking at the brain MRI changes and the number of cortical tubers and their distribution, measuring their intellectual abilities and their adaptive functioning. And then phase 2 was a follow-up about some 7 or 8 years later, focusing on a range of, as the children now had got older and we were able to evaluate some of the behavioural and cognitive and neuropsychiatric features in more detail. We were looking at features like ADHD, autism, sleep difficulties, etc. And phase 3, which has now just started, is focusing in more detail on cognition, different aspects of cognition, and brain imaging using EEG and MRI. But this has been going on now, since 2001 when we first started recruiting, so almost 15 years. And clearly it's meant a lot of commitment from the families themselves to continue to participate in a project of this kind. And we've tried to keep families informed about the study through newsletters, Christmas cards, Facebook, Twitter, etc., telling people about the results from the study and trying to keep in contact when people move, etc., so that we can continue to gather information. And it's been great, the commitment and involvement of families in the project, because without that, we wouldn't have, we'd really struggle. We wouldn't really get a good representative picture about the nature of the difficulties. So the findings from phase 1 of the study, I'm just going to focus for this bit, because at that time, remember, the children were largely quite young. They were sort of 1 to 10 years of age or so. And because of that age range and the ability profile, we were really focusing on evaluating their intellectual abilities and trying to understand what sorts of factors are relevant in determining the intellectual abilities of the children that when we were assessing them at about 2+ years of age. And this figure here illustrates the key components of the risks that lead to intellectual impairment. So here we have something we call tuber load, which is really a measure of the extent to which the brain involvement in tuberous sclerosis, and it's derived from the count of tubers in different parts of the lobes of the brain. And then here we have an indicator of the severity of the epilepsy during the early periods in the first year of life, the second year of life, and beyond. So that gives us an idea as to how difficult and intractable the epilepsy was. And then here we have the nature of the gene mutation, whether it was a TSC1 or TSC-assictaed gene mutation. Now this analysis tests really what are the sort of significant paths linking these different features of tuberous sclerosis to the outcome. And what this showed was that the type of mutation determines or influences the extent of the brain involvement. I think you probably may have heard or been aware of that before, that TSC1 mutations tend to lead to less severe phenotype and difficulties, fewer tubers in the brain, and then the number of these tubers in the brain, the extent of abnormality determines the severity of the seizures that you have. You've probably also heard about how tubers do seem to act as or the regions around tubers as well, the focal point for epileptic discharges. So obviously the more you have, the more likely you're going to have epilepsy, and the more difficult or intractable that epilepsy is going to be. And then the severity of the epilepsy was linked to the extent of the intellectual difficulties that the children had. So these initial analyses were sort of highlighting the fact that we needed to be thinking more about what's going on, particularly during the early phases in terms of the severity of the epilepsy. And within this cohort, there were, I mentioned that 24% or so who were diagnosed with tuberous sclerosis prenatally or in the early neonatal period before epilepsy started. And we were particularly interested in trying to track the development of that group of children to see how their development progresses in relationship to the onset of the epilepsy. So this summarizes that group of children, and in the top bar we've got an estimate of the level of intellectual abilities here, and this is for the types of seizures that were not infantile spasms or epileptic spasms, and this is from before seizures and then 1 month after 1 month of seizures, and then for 2 or more months of seizures. And as you can see, if you in this group of children, if you didn't have, if your epilepsy started but it didn't involve infantile spasms, there wasn't a lot of change really in your intellectual ability over time. Whereas amongst the children who developed the form of epilepsy called infantile spasms, the intellectual abilities decreased over time, particularly to most extent in those who had infantile spasms that went on for longer and that were more difficult to treat and didn't respond to treatment so well. So this was sort of again highlighting the importance of that period in the early period in the life and the epilepsy. You would have been hearing about some of the research that's going on in order to try to see the effectiveness of treatments in that early period in preventing developmental problems. So, and as another sort of illustration of the potential importance of this and the way in which new treatments and improved treatments might be leading to a better picture for families with a child with tuberous sclerosis, we've been looking at information about intellectual abilities in 3 different what we call cohorts of individuals with tuberous sclerosis. Some of you may have heard of the Wessex study. This was a study that John Osborne and Finbar O'Callaghan initiated and that I helped with in terms of looking at intellectual levels and abilities in that population. And this was in the Wessex region of England, and many were born in the 20s, but right up until the 1995. And this sort of charts the distribution of intellectual abilities in that population. And as you can see, there's a big group down here who are the most impaired, severe or profound impairments. So quite a very significant proportion. And the ones here are those that had infantile spasms. So as we were saying, that the presence of the infantile spasm seems to be related to difficult outcomes. And the same picture was really evident in a study that Julian Sampson in the UK and colleagues had done on a Cardiff sample from who were born 1930s to 1995. You can see this big group down here with severe or profound impairments, most of whom had infantile spasms. But this is our study of the TS2000 population born 86 to 2005. And as you can see, the distribution has changed. So we don't any longer have this big group down at the bottom here. And we think that this might reflect the fact that there are now better treatments for epilepsy in the early years, particularly the introduction of vigabatrin, for example, and also we need to bear in mind that in these 2 samples, some of the individuals might even have had infantile spasms before steroids were available or recognized as a possible treatment for infantile spasms. So we think that adds sort of further evidence to suggest that that's an important thing to be focusing on. Anyhow, new findings from the TS2000 study. I'm going to ask Charlotte to summarise for you.
Thank you. Thank you very much for the introduction, Helen. I know we're a bit behind on time, so I'm going to be as quick as I can. So if I'm rushing through, that's why. So Patrick's introduced phase 1 of the study. I had the opportunity to work on phase 2 of the study with Lisa as well, who you just heard from, which has been going in the last couple of years, with a focus on autism and ADHD and intellectual outcomes a bit later in childhood. So this is the phase 2 team. You've just heard from Lisa and Patrick. We also have a postdoctoral study coordinator working on the study, research assistant, and a few students that come and work with us for a few months at a time and help us with data collection and so on. Patrick has already mentioned our very generous funders for this project. So what have we been doing over the past 2 years? And in teams of 2, so there's always 4 of us around, we've been visiting families all over the UK. So we've gone to the other side of Northern Ireland, down to the bottom of Cornwall, if you know where that is, and bits of Scotland as well. And it has been a great journey for us meeting all these families. You can see our beautiful English weather there as well. And Patrick already mentioned the kind of things that we've been doing. So it's a lot easier for families with TSC if we go and see them at home. It saves them having to travel to see us in London. So everything we're doing can be applied in the home environment. So we were collecting information from parents on their child's developmental history, in their current behaviour and any problems they're experiencing in their mental health. And we also got some information about the services and investigations that they're receiving to see if they're similar to what is recommended in the surveillance guidelines. With the child with TSC, we conducted cognitive and behavioural assessments that were suitable for their level of functioning, so how high their IQ is. And we also, with a subset, were able to get information on cognition, which is something that Lisa mentioned earlier. And we also collected a bit of data with unaffected siblings. Unfortunately, we don't have the findings quite yet, but we know the siblings really enjoyed being involved in the study, and we collected some information also on their mental health and well-being. So hopefully in the future, we'll be able to share that with you as well. We got an update on medical history from their GPs and clinicians in terms of epilepsy and also the extent of brain involvement as well. And again, like I said, we got information on the services that the families are receiving for their TSC and whether they have a care coordinator in place that helps them to manage all the different medical aspects of the condition. Okay, so just looking back at intellectual ability as an outcome in TSC, as Patrick just explained, we know that genetics, the amount of brain involvement, and epilepsy severity all have an effect on your intellectual outcome. In phase 2 of the study that I've just been working on, where the children are aged from 7 years and up, this is the kind of demographic of intellectual outcome that we found. So nearly half of our sample have a normal IQ, meaning that they're in the normal scale of intelligence. And we also were able to measure changes in IQ from phase 1 to phase 2 and found that nearly 25% or a quarter of the sample had almost an improvement in their intellectual outcome. And when we tracked this back to their medical history, we saw that that's related to the amount of time they had seizure-free in the first 2 years of life. So it's really going back to how important those first 2 years are. And this looks a bit scary and complicated, so I'll try and break it down. But it's talking a bit about what Patrick just mentioned, but just adding on the extra time point that we have over here. So as Patrick explained, we can see that there seems to be a pathway of risk to intellectual outcome going from the type of genetic mutation through to the number of tubers that are in the brain, through to epilepsy. And what we found currently in the children that are aged 7 years and above is that it's this early epilepsy occurring in the first 2 years of life that predicts their current IQ. So it's this, I think I highlighted it, it's this pathway that's the most important. So although there's relationships between their epilepsy severity at the moment, the outcome is predicted by how bad their epilepsy was very early in life. I hope that makes sense. We found very similar findings with autism symptoms. So again, the epilepsy in the first 2 years of life seems to predict their autism symptoms in around preschool or just starting school age, and also their current autism symptoms. So it seems to be this period here that is the most important. And just wanted to highlight quickly our kind of rates of an autism diagnosis in this sample. We found that up to 80%, or I think that looks more like 75%, had either a diagnosis of autism or had the kind of sub-threshold symptoms that Lisa was talking about. So they don't quite meet the criteria, the clinical criteria for autism, but they still have kind of significant behavioural difficulties. I'm going to skip this. If you're interested in ADHD, come and find me. So these findings suggest to us that the first 2 years of life, as I said, are the most important. However, what's actually happening in early development? There's hardly any studies that actually track these babies from birth. So at the moment, as we mentioned a few times today, a lot of our assessment tools with babies rely on parents reporting their baby's skills, often in a retrospective way. So we're asking parents to remember what their child was like in the early years. And we're also not measuring the social and attentional difficulties that we know are highly prevalent in these babies. And almost most importantly, we're unable to capture the very potentially sudden changes in epilepsy that could occur in the first years of life. So we've just started a new study supported by the Tuberous Sclerosis Association in the UK. And the aim here is to identify cases of TS that have been identified prenatally or antenatally through routine ultrasound scans, through the growth of the cardiac rhabdomyomas, so the growths on the heart that have been mentioned today. We set up a clinical network working with specialist clinics in the UK, as well as fetal medicine units that will hopefully pick up these cases. And just to give you a quick overview of the design, we're going to be seeing these babies at several time points throughout development. And we're especially interested in what's going on in the first kind of 8 to 10 months when we know that seizures start. And it's likely that we'll get a percentage or proportion of infants before their seizures even begin, which means that we can measure behaviour, cognition, and brain function before and after their seizures. So we're collecting information on behaviour and eye tracking, which gives us an index of how well they're attending to different things on the screen. We'll be collecting EEG at certain time points as well, so we can track changes in the EEG and link that to epilepsy. And we'll also be collecting MRI, which is a measure of the images of the brain very early in life at 1 month. And we'll be collecting information on their genetics as well. So very quickly, we're hoping that these findings will give us an early readout and tell us which infants are potentially most at risk for developing autism and intellectual disability, so that we can identify them and target treatment towards them. So as you know, new treatments are showing really great promise for the physical manifestations of TS. And there are trials ongoing to see if these have similar effects for the neuropsychiatric manifestations. So hopefully at some point I'll come back and I can tell you some of the findings that we have from our new infant study. And just very, very quickly, you're probably wondering why we're here from London, but we'd really like to make some international links in TSC research, not only to increase the scope of our studies, so get more participants, so we can have more interesting findings, but also because we know that the more countries that are involved in this research is going to lead to a higher impact, not just for science, but also for the patients and their families. So yeah, again, watch this space. Hopefully we'll be doing some work with Australia at some point soon. So thank you very much.